Good morning. Today we are going to deal with the fetal skull. Let's start. The fetal skull consists of three parts, that is face, vault and base. Face is formed by the facial nerves and the vault is formed by cranial nerves, and in base you can see the foramen magnum where the spinal cord runs through. Now let's move on to the bones of the fetal skull. The fetal skull consists of two frontal bones, you can see here, two frontal bones, two parietal bones, one occipital bone and two temporal bones. Clear? Two frontal bones, two parietal bones, one occipital bone and two temporal bones. Now let's discuss about the fontanelles. So there are two fontanelles, that is anterior fontanelle and posterior fontanelle. The anterior fontanelle is of diamond shaped. It is also called brecma and it will close in 1.5 year. When it comes to posterior fontanelle, it is of triangle shaped. It is called lambda and it will close in 1.5 month. It is called lambda because it passes through the lambdoid suture. For your additional knowledge, there are two more fontanelle, that is anterolateral fontanelle. See this one is anterolateral fontanelle and the other one is posterolateral. Posterolateral, anterolateral. So let's move on to the sutures. The first suture is frontal suture. So that comes between two frontal bones. The second suture is coronal suture. See, coronal suture. That comes between frontal and parietal bones. Coronal suture that comes between frontal and parietal bone. The next suture is sagittal suture. That comes between parietal bones that divides the skull into left and right. See, sagittal suture. It comes between the parietal bone. It will divide the skull into left and right. Next is lambdoid suture that comes between two parietal bones and one occipital bone. See this one, lambdoid suture comes between two parietal bones and one occipital bone. So these are the diameters of the fetal skull. So there are two types of diameters, that is anterior posterior diameters are these 6 and these three are the transverse diameter. The first anterior posterior diameter is suboccipito-brecmatic, that is this is occipito, suboccipito means under the occipito to the brecmatic, center of the brecma, suboccipito-brecmatic. It is 9.5 centimeter. The next diameter is suboccipito-frontal, that is under the occipito, suboccipito, frontal suture midline we should go. This is 10 centimeter. Next is occipito-frontal, that is from the occiput bone to the center of the frontal suture. It is 11.5 centimeter. Total 6 diameters are there in anterior posterior diameter. In that 3 is from the posterior, 3 is from anterior. So first we have completed on the posterior side. Let's move on to the anterior side. So the first anterior diameter is mendo-vertical, is measured from the center of the chin to the highest point of the sagittal suture. Center of the chin to the highest point of the sagittal suture. This is 14 centimeter. It is the highest diameter in the fetal skull. Next is submendo-vertical, that is submendo-vertical to the highest point of the sagittal suture. It is 11.5 centimeter. Next is submendo-brecmatic, center of the brecma, submendo. From under the mendum, that is submendo, to the center of the brecma, it is 9.5 centimeter. Next is transverse diameter. So first transverse diameter is biparietal diameter, that is from one parietal bone to the other parietal bone, biparietal. It is 9.5 centimeter. The next transverse diameter is supra-subparietal, That is from the lowest point of one parietal bone to the highest point of the other parietal bone. Like this it will come. Lowest point of one parietal bone to the highest point of the other parietal bone. It is 9 centimeter. The next transverse diameter is bitemporal diameter between two temporal bone. It is 8 centimeter. The next transverse diameter is bimastoid. Bimastoid diameter. It is 7.5 centimeter. Now you got a clear picture about the fetal skull. So we have discussed about the fetal parts, bones, sutures, foramen, and about the diameters. So thank you.